Good morning, good afternoon. Welcome to today's webinar on COVID-19, practical information for you and your family. My name is Judy Thompson. I'm the Director of Education at the Association for Vascular Access, and I'm joined by Blake Hodgkiss, who is in our background answering questions, as well as I'll soon introduce Dr. Hudson Garrett. AVA is an association for medical professionals that specialize in the art and science of vascular access. This is our first webinar where we're reaching out to the public and non-medical community. So we want to welcome you specifically to our family here at AVA. We do have many healthcare workers joining us today that, similar to you, want to know what the practical information is to keep themselves safe and their families safe as well. Today, as soon as the presentation starts, Dr. Garrett and I will both go off video so you can see the slides a little bit clearer, and also to help with bandwidth, as we have a lot of kids in our neighborhoods, I think, doing homework, and sometimes makes our video get a little bit blurry. During the webinar today, we will be having a couple of poll questions, so we would love your participation. And what you'll do is the little screen will come up, just vote as you see appropriate, as well as on the side of your screen, if you're on a computer, there's an area where you can ask a question. Now, we did get a lot of questions ahead of time when you registered, and we are going to try to go through each and every one of those. We may go longer than the hour this is scheduled. You guys are welcome to come in, come out, whatever is appropriate for you and works for your life. But we're going to go until we have worn out Dr. Garrett or answered all the questions. So please hang in there with us. We're happy to have you. Now, without further ado, it's my pleasure to introduce Dr. Hudson Garrett. He holds a national certification in emergency medical technician and a COVID response member with ProCare Emergency Services in Atlanta, Georgia. He has a faculty appointment as an adjunct assistant professor of medicine in the Division of Infectious Disease at the University of Louisville School of Medicine. He has also co-founded the nonprofit, the Infection Prevention Institute, to help shepherd dissemination of best practice in infection prevention and control across the healthcare continuum of care globally. He holds a graduate certificate in hospital epidemiology and infection control. Dr. Garrett serves as the public safety liaison for the Greater Atlanta chapter of Associated Professionals in Infection Control and Epidemiology. He is also a certified tactical medic and holds a national certifications as public safety telecommunicator, communications training officer, from the APCO. He has additionally graduated from the Barrier Precautions Controls for Highly Infectious Disease course operated by the Federal Emergency Management Agency Center for Domestic Preparedness. He is board certified in vascular access, critical care, infection prevention, control, and patient safety. Hudson, it's all yours now. Thank you.
Perfect. Well, good afternoon or good morning to you, depending upon where you're calling from. As Judy mentioned, it's our absolute pleasure to welcome many of the members of the public as well as some of our healthcare professional colleagues for today's presentation. If you do have any questions that come up throughout the presentation, we encourage you to send those in through the chat box, which is located on the right side of your screen. But for now, let's go ahead and get started. The objectives that I have for today are to look at three basic things. One is to take you through where we are today currently and where we anticipate going in the future. The second thing, which I think is extremely important for members of the public, is what are sort of those potential treatment and long-term options to protect the general population? And then lastly, we're going to share some information on steps that you can take to protect yourself. I'd like to point your attention to the right side where the handouts are, and you'll actually see that Judy has kindly uploaded both the slide presentation for today as well as some additional CDC resources that I'll be discussing. As always, I want to bring everyone's attention to the most up-to-date information is always going to be available on the Centers for Disease Control and Prevention website. We've included that website link there. This is an active link, so if you click the handouts when you download those, it'll take you directly to that. If you're a business owner, a member of a church, you're interested in going back to the gym, you want to know if it's safe to go to a restaurant, that website has direct information about each of these things, even if you want to take an Uber, for example. So CDC's done an amazing job of trying to create some of this information. So I wanted to start with a little bit of a basic information about the background of really what's going on. So the term COVID-19 actually refers to the illness that's caused by this novel coronavirus. The word novel simply means new. And so coronaviruses have actually been around for a long period of time, for many, many years. And they've caused things that we're all familiar with, like SARS and MERS, and now this new novel coronavirus. When you see the name COVID-19, to break that down, the CO stands for corona, indicating the type of virus. The V stands for virus, the D stands for disease, and the reason that it's got a 19 is that 2019 is the year where this was first discovered. Patients and people that have coronavirus were originally thought to present with these three basic symptoms. So someone would have a fever above 100 degrees. They would typically have some type of dry cough, and in many cases, they would actually have shortness of breath. Now, that has since changed, and we're seeing other symptoms like new loss of taste or smell that's also emerged. When we refer to the incubation period, we're talking about sort of the lengthy process that virus stays in the system. When we look at MERS and SARS, we have experience with those for many years, and the incubation period was about 2 to 14 days. With this new novel or new virus, this new coronavirus, we anticipate it's around 4 to 5 days is the average. But people can also present and not have any symptoms at all. And so if you look at the news media, you'll find that many times this is actually mentioned. There's also this concept of what we call super shedders. A super shedder is essentially someone that has no symptoms but is actually shedding or releasing large amounts of virus. And so these could be people that you're interacting with on a daily basis that don't appear sick, but actually are shedding the virus. And one of the common questions is, how long can someone shed the virus? And can they shed it prior to actually showing symptoms? And the answer is yes, they certainly can. This is why the CDC made some general recommendations about washing your hands, wearing a face covering, staying home if you were sick, if you were a high-risk population. That's really the basis for many of these recommendations. So I wanted to go a little bit deeper and talk about where some of the current recommendations that you may have heard about are coming from. So number one, when I used the word novel, I said that meant new. When we have a new virus, that means that we don't have a vaccine, we don't have an FDA-approved treatment, and we don't have what we refer to as herd immunity, meaning that other people that are vaccinated are actually going to protect the general population by essentially spreading that immunity, even to people that don't have the vaccine. The best way that we know to prevent the virus is to not be exposed. So if you're ill, stay home. If you're over 65 or have a chronic health condition, the best practice would be to stay home and avoid any exposure that's not necessary. But we recognize that the majority of times this virus is spread through close contact. So when we hear that word social distancing, this is where this comes in, is we recognize if we can't get close to people, then it's going to be very, very difficult for the virus to spread. So there are many people that ask questions like, can I go to the grocery store? Can I go to my doctor's appointment? Should I be wearing a mask? And we're going to go through all of those questions at the end of today's program. This virus, and I want to be very clear about this, is primarily spread through respiratory droplets, meaning large particles of respiratory secretions that are spread from person to person or person to the environment, meaning if you have a surface that you're touching, if you share any type of common things like a comb or hairbrush or toothbrush, and we'll talk a little bit about that here in a second. But there is also evidence that people that do not have symptoms can still spread this virus, which is why it's very difficult for us to predict where this virus is going in the future until we have a little bit better handle on this. Now, you have heard in the news that this is a pandemic, which is very different than an outbreak. A pandemic has got global implications. And so the fact that this is a pandemic, meaning we have widespread transmission globally, plus we don't have a proven vaccine that's FDA cleared, and we have very limited treatment options, many of which are experimental, can cause a lot of fear. We recognize that this has huge implications, not just to members of the public, but honestly, huge implications to healthcare providers. So if you know a healthcare provider, a first responder, or an essential worker, please take a moment to reach out to them, check on them, tell them thank you for their work. This is a very difficult time for healthcare providers and first responders especially. And there's other essential workers, including people like truck drivers and those that operate our grocery stores and gas stations that are ensuring that the American economy can continue to run. we do want to recognize that there are opportunities for us to reach out and check on people to make sure that these impacts are not causing adverse effects to your mental health. We've seen many instances, unfortunately, where healthcare workers especially have committed suicide as a result of the tremendous stress caused by this pandemic. And we want to recognize the healthcare workers that are on our phones today. So the big question is, what is the new normal? What does that look like? Is it going to be we're going to be wearing masks for the rest of our lives? Are we ever going to feel safe going out? Is it safe to travel on a cruise ship in the future or take an airplane ride? And we'll go through a little bit of that here. COVID-19, however, is here to stay. It's not going away. Just like influenza, the flu is not going away, the common cold. And so it will be part of our new sort of landscape within the healthcare setting especially. But I'm very, very optimistic about many of the actions that are being taken both on a federal level, state, and local. And there's a lot of public-private partnerships that are stepping up to the plate to deliver for the American people, which is really exciting. So I wanted to share with you a little bit about the federal response to try to give some truthful information about what's taking place today and what we'll see in the future. Number one is there is a widespread amount of testing taking place across the United States. One of the biggest questions here is what test should I get and when should I get it? And I've actually broken that down here in a few slides, and we'll go through that information. I also recognize that many of you have this question that's come in through the question and answer, and we'll get to that as well. There is a tremendous amount of public-private partnership, as I mentioned before, not just for personal protective equipment, but also for therapeutics or what we call treatments, and then certainly a vaccine. When we look at the long-term implications of COVID-19 infection and sort of the pandemic, the best way for us to stop this is to have an active vaccine that is widely available and widely administered across the general population. If we look at the sort of general rates of compliance with people getting an annual flu shot, however, we have some opportunities for growth, let's just say that. And a vaccine is not going to be curative, but it will certainly help with the herd immunity, and we absolutely expect to have better therapeutic or treatment options here very shortly. The Food and Drug Administration regulates not just drugs and medical devices, but they also regulate what we call PPE or personal protective equipment. So for those of you that are on the line that are looking for sources of masks or gloves or hand sanitizer, the FDA has regulatory jurisdiction over all of this. And I will tell you that there's been some really great things taking place in this area and some really unfortunate and criminal things related to manufacturers or small organizations that are manufacturing PPE that does not meet FDA standards. We've also seen a large increase in the amount of PPE that's coming in from China that does not stand up to the current FDA's stipulations for protection of healthcare workers and other personnel. So the FDA has cracked down on these entities, and they're doing a phenomenal job despite having tremendously strained resources to ensure that what is coming in to protect us is going to be safe. If you have specific questions about PPE that you purchased, you can go to the website for FDA, which is fda.gov. On that homepage, there's a coronavirus tab, and it will take you to a list of currently acceptable personal protective equipment that you can purchase here in the United States. And we'll go through who really needs that here in a second. And lastly, in my career in infectious diseases, I've seen some amazing things and I've seen some scary things. One of the best things about this particular pandemic is that we are seeing a rapid acceleration of vaccine trials far faster than we've ever seen for any other outbreak, in my opinion. I did want to show you the live map that is produced by the Johns Hopkins University, which does a phenomenal job at looking at sort of the global impact. If you're interested in tracking this information for your own knowledge, I've included the web link at the very bottom. On the top left, you'll see the total number of confirmed cases for coronavirus across the world, and on the right side, you'll see the total number of deaths. Below that, on the left, you'll see it broken down by country. So you can see the U.S. is roughly at 1.3 million cases. I want to stress something that is often asked to me, which is, do we expect to see continuing increases in overall cases in the U.S.? And the answer is absolutely yes. As we do more testing, and we're doing more testing proportional to per capita than any other country in the world, we will 100% see more positive tests. The information that I'm watching, though, as a healthcare provider, is to determine, are we seeing increases in hospitalizations and deaths? Do we have adequate resources in the healthcare community to care for any people that need healthcare services? And those are the numbers that I'm particularly concerned with. And while any death above zero is terrible, what we are looking for is trends that are decreasing in deaths, decreasing in hospitalizations, and that we have adequate healthcare resources to care for these individuals. If we drill down a little bit further into cases specifically in the United States, this again is from the Johns Hopkins University, and they have it broken down by county. So you can actually go by state or county or territory, and you can see in your local area what's going on. They've also added a new social map that shows outbreaks associated with large gatherings. So very frequently, and CDC's put out great guidance about this, about funerals and parties and those types of things where there's going to be mass gatherings of people, and those are really not recommended right now because of the social distancing that's in effect. The community spread is simply referring to, is this something that is widely being spread throughout your local community? And all 50 states, as well as U.S. territories, do have COVID cases, so it is everywhere. But community spread may not be taking place in every geography. So you very well may live in an area that does not have widespread community spread. And if you do, you're very fortunate. That could change on a regular basis. And this is why the White House Coronavirus Task Force has issued what we refer to as staged reopening guidelines that give the governors the power to look at local data based on public health information, as well as available healthcare resources like hospital beds and capability to respond should there be a surge in order to determine how to reopen states. And while this is a very politically charged topic, we want to look at it from a data perspective. And there will be certain areas that are doing much better, and there'll be certain areas that need more attention. And so this map that's coming up on your screen now actually looks at these sort of outbreaks that are localized associated with events. So for example, I live here in Georgia. You can see that we have a red dot that looks at 2 to 4 events that have actually caused coronavirus outbreaks locally. Some areas have the darker dots that you can see have basically shown over 5 events. And so this is a great source of information to look for that. The next thing I wanted to mention, and is a very common question, is what are we going to do about schools? School closures, which is outlined by the map here from CDC, have been widespread and massive. And the impacts of this are far beyond just the public health impacts, but think about the learning for these students. And so a very common question I am asked is it safe to go back to school? I absolutely feel that it is safe to go back to school with the right stipulations and infection prevention mechanisms in place. That being said, you may have circumstances where a faculty member, for example, has a chronic health condition and is over 65, and they don't feel like they could come back to work. And so we're going to have certain areas of question and answer that we'll have to address this, and that'll have to be followed by the CDC guidelines. Everything that I'm showing you today, CDC has issued some type of public health guidance for. And the great thing is that it's updated regularly based on the data that is being collected. And so it's not uncommon at all for CDC to make changes to guidance on a weekly basis. And that's what we want to see is information that's driven by public health data. Another common question that I have is, can I get tested? Where can I get tested? And how often are people being tested in the United States? So I wanted to share the information, again, based on the data available that says we're approaching 10 million tests. And this was updated as of May 12th. So this was, last night. The total number of positive tests are about 1.5. So that means out of those that were tested, about 15% of those samples were positive. Now, again, the 15% positive may sound very high, it may sound very scary, but that does not mean, and I want to say again, does not mean that these individuals were hospitalized. It doesn't mean that they did not survive the disease. It doesn't mean that they even sought healthcare services. So what we're finding is that many people actually self-recover from this virus on their own with little or no medical intervention. Those that are over 65, have chronic health conditions, are in a nursing home, they're at the most vulnerable risk associated with this. And so again, I want to stress that. And the last piece of data that I'll share with you before we go into some of the more granular information is we always want to know, are we capable of responding? So if we think back to January and early February, one of the big challenges was, do we even have enough hospital beds in order to address this threat? And in some cases, we did not. And so CDC is now in a real-time basis working with the state health departments to look at the total number of inpatient hospital beds, meaning, how many beds could we admit a patient to versus the percentage of ICU beds that are occupied, recognizing that, there's sort of two different flavors, if you will, that patients can have of coronavirus. That does not require medical intervention, and that does. And the ones that do, a lot of times are requiring intensive care support. And so our goal is to keep people that can self-quarantine and self-treat at home, and then we have the available resources for those that require some type of advanced medical care. I can tell you from personal experience, many hospitals across the United States are at a very low occupancy rate, so they have lots of beds that are open. We're continuing to see ICUs discharge patients, which is a great day for every healthcare provider to be able to send these patients home, and we'll continue to monitor that very carefully. Several of you I know have emailed or written in questions that you have children, and so we wanted to be sensitive to that and talk about the differences in that pediatric presentation. What will these kids look like from a symptom standpoint? So a little bit different than what we talked about with adults, but most kids are going to present with, cold-like symptoms, which right now is probably an okay time compared to when we get into the fall, when we have lots of other respiratory viruses that are being transmitted out there. So, fever, runny nose, cough, diarrhea, and vomiting are all common symptoms that we see. And if you watch the news in the last week, we've seen this new, what we refer to as pediatric multi-system inflammatory syndrome, which is very closely linked in many cases to COVID-19 in children, but we're really learning more about this on honestly a daily basis. One person has died as of yesterday, and again, this is something that we see, unfortunately, pretty frequently with new viruses. We saw this several years ago, if you recall, with kids that had unexplained paralysis. So viruses can be very difficult to detect in children, and in many cases, unfortunately, the treatment is not there yet. And so if you do have a child, this is something to think about. This has not been widespread. I want to repeat, this has not been widespread, but we do want to make sure that we're looking carefully at our children, and if they become symptomatic, especially get them tested. So I wanted to share with you a few things that are recommended to keep you safe, right? And these are all very basic things that you can do easily today, and in most cases at no charge. The first thing that we always recommend with any infectious disease outbreak, not just coronavirus, but any infectious disease outbreak, is to simply wash your hands. I go back to a quote that a colleague at CDC gave me many years ago when I started my career, and she said, Hudson, if we could simply wash our hands when we should, about 90% of the world's infections would simply disappear. And that's a very important statistic, I think, to remind us of the value of basic hand washing. This can be done with soap and water or an alcohol-based hand rub as well. The second thing is that if you're sick, stay home. And this, again, is a general principle for reducing the risk of infectious illnesses, especially if you're working. Your employer does not want you to come to work sick. And I want to be very sensitive to the economic impacts. Many have lost their jobs. They've been furloughed. They've had a reduction in hours. And so recognizing that many Americans live paycheck to paycheck, we also want to speak to the employers today that are on the line. And we need to have human resources policies that enable workers to stay home when they're sick as well as receive their pay. We don't want to infect the workforce, but we also want to make sure we take care of our employer as well. The third thing, which is really important, is staying away from those that are sick. This is where that social distancing comes in. And again, you may live in a household where someone does come down with COVID-19 infection. And there are ways to stay safe from that, as well as allow that person to self-quarantine and isolate. And one thing that we can do is disinfect our commonly touched surfaces. Basic EPA-registered disinfectants that are available out there will take care of the coronavirus. The great news about this new novel coronavirus is that it's really easy to kill outside of the human body. So if we get it on our hands, we can wash it away with soap and water. Alcohol-based hand sanitizers work well, and most common disinfectants that you have access to will work also. And the last one we call our respiratory etiquette, meaning that when you're coughing or sneezing, cover your mouth. Use a face covering if you're going out in the public, and we'll talk a little bit more about that here in a second. I did want to highlight some of what we refer to as our most vulnerable populations, the people that are going to be at the biggest risk for harm from coronavirus. And we're going to start with people that are over 65 years of age. This includes people like my own parents that I worry greatly about. This virus has unfortunately prevented me from seeing my own mother on Mother's Day. It's going to prevent me from seeing her on her birthday tomorrow. I haven't been able to see my family in quite a period of time, and that's really hard for me as a healthcare provider, but I want to be respectful of the love that I have for them by keeping them safe since I have been exposed. Those that are in nursing homes are at huge risk. This has been proven over and over again. If you look at just the New York data, over 5,000 of the deaths in New York alone have come from nursing homes. Nursing homes are under threat right now. Having been in these people as in these facilities, should I say, as a healthcare provider, I have seen some really good things and some really bad things, and so I encourage you to reach out to the nursing homes if you are, have someone in the nursing home, or if you're offering to help make masks. Whatever you can do, these nursing homes need our help. And then certainly those that have underlying significant medical problems, like chronic lung disease, diabetes, if you're severely obese, if you have chronic kidney disease. We're seeing a big problem right now with individuals having access to dialysis services as well. So commonly, people say, well, should I wear a face covering? And really, what is a face covering? Do I need to wear a respirator? Do I need to wear a surgical mask? And a face covering serves really one basic purpose. It's to keep things that you might have that are infectious from going to other people. So the thought is, if we recommend generally for the population to wear face coverings, that if I have one on and you have one on, we're not going to get each other sick, right? It's not going to prevent you from getting something from someone else that's not wearing one. And so a face covering should fit snugly, and you can make these yourself. They should include multiple layers of fabric. One single layer is not very effective. But they also have to allow you to breathe. This is one of the biggest complaints. And having worn one of these masks for over 12 hours yesterday, it is very uncomfortable when we wear these respirators. So respirators are not recommended for the general public. I want to say again, respirators are not recommended for the general public's use. We are really reserving those respirators for healthcare professionals that are at high risk during certain types of procedures, like where there's aerosols that are generated. The CDC has provided guidance on making your own homemade mask. If you're interested in that, you can actually download those links down at the bottom of the page here. So what about pets? This is sort of the next question. Having a dog myself, my dog is my child. I adore my dog, and I worry about, if I come home and become symptomatic, what do I do with my pet? And so there has been very, very limited data that says that there can be transmission to pets. Again, this data is extraordinarily small. And so if you become symptomatic, the Veterinary Association really recommends that you not interact with your pet if you can. And certainly if you need to walk the pet or something like that, keep your social distancing, make sure you're doing hand hygiene, all those types of things. But there's really not a lot of huge concern here, but I wanted to address that since many of you had that question. I also want to thank the general public that's on the line today, and many of you are actually family members or parents of healthcare providers, and you probably have heard the horror stories or seen it on the news. We've seen some of the best in the U.S. Society by coming out and supporting our healthcare providers and first responders, but we also want to appreciate those that have taken this information and have become activated and are trying to protect public health. Our public health authorities, I live here in Atlanta, I know the people at the CDC personally, many of them. What they're going through right now is simply unheard of. It's beyond Ebola. It's beyond everything that they've gone through before. And there's tremendous pressure to, produce new guidelines, produce vaccines, produce treatments, and really also make good recommendations that are not going to hinder the American will that we have. Hand hygiene is absolutely the best thing that we can do to stop transmission in addition to staying away from sick people. If you're looking for hand hygiene products and recommendations, you can always start with soap and water, which right now the supply chain for soap is pretty good. You can also make your own alcohol-based hand sanitizer. There are instructions to do that on the CDC website. You can also, quite frankly, reach out to local distilleries and other places that are making this and distributing this, a lot of times free of charge. If you are making your own alcohol-based hand sanitizer, the CDC recommends that it's between 60 and 90% alcohol. I would also recommend, if you're making your own, that you invest in a good hand lotion that you can use after that solution dries. You will see a lot of drying, unfortunately, with some of these higher alcohol concentrations. If you have a commercial product like a Purell or a Germex or something of that nature, all of these are meeting the FDA's criteria for killing coronavirus. It is very, very easy to kill. So if you have any of those commercial solutions, the gels or the wipes or anything like that, you're good to go from that perspective. And we always want to recognize that hand hygiene is going to stop the transmission of many, many respiratory pathogens, not just what we're talking about today with coronavirus. Another common question is, can I go to parks? Can I go exercise outside? And the answer is yes. We are not at all, we should not be encouraging anyone to stay in their house and not get some type of recreational activity as long as we can do it safely. I love to see people walking down the street as long as they're social distancing or wearing a mask. I love to see people out enjoying the sun. These are all things that are really important to our mental and physical health. And so CDC absolutely recommends that you can go and enjoy these activities as long as you can do them safely. Now, I will tell you, I drove past the park the other day, and I was alarmed to see it looked like 1,000 people had crammed in there. That is not a place that you would catch me. And so, things that are going to be high-touch surfaces like playgrounds, things like that, where you're going to have shared surfaces are not recommended currently. Another question is what if you're pregnant? We are still learning a lot about this, but the mother-to-child transmission of COVID-19 is very, very limited risk. We have seen this happen a few times with data that we're not even, quite frankly, sure is accurate. And so it's very unlikely that this will take place, but I just wanted to make sure that we address that as well. So one big question that comes up frequently is, what do I do if I'm sick? Well, you should stay home, and unless you have to go receive medical care. And if you do go see medical care, then make sure you call ahead. So if you're going to the hospital or your local doctor's office, call ahead. Let them know that you're symptomatic and you have symptoms, or if you've tested positive already in the community, so that they can take appropriate precautions. Do not be alarmed if you go to the emergency room and you're actually screened outside of the hospital in a tent. We've seen many hospitals that are doing this in order to prevent people getting into the hospital until they're properly isolated and you have a mask on. If you are going to seek healthcare services, wear a mask when you go. Make sure that you monitor your own symptoms and you separate yourself from other well people, and then avoid sharing any personal items like toothbrushes that are going to be shared between uses. There's a lot of misinformation available out there about diagnostic testing. What should I get? When should I get it? What does it actually tell me? So there's essentially two different ways to look at this, and we'll go through this in the next slide. But there's a test to determine whether or not you actively have the virus. Now there's a test that determines if you ever had the virus and sort of what your antibody or immunity level looks like. And in addition, the FDA in the last week cleared what we refer to as a new antigen testing, which can be done in doctor's offices. It's what we refer to as a point-of-care test, meaning that it can be done right in the doctor's office with an instantaneous result. And this will help determine whether or not you can go back to work or your normal activities. And much of this is also being coordinated at the state level. So I wanted to break down one of the common questions about the test, which is what's a viral test versus what we refer to as a serology test. So if you go to the doctor's office or a public health clinic or a drive-through clinic, and you're trying to determine whether or not you actually currently have the virus and they swab you, that's a viral test. That viral test is simply going to tell you, yes, you have the virus, or no, you do not. If you do the antigen testing, which is where they essentially prick your finger, that is only about 85% effective. So if that comes up positive, your healthcare provider will also confirm that with a nasal swab, and they'll send that off to a laboratory to confirm that you're absolutely positive. The serology test, on the other hand, is what we refer to and the news media has called as the antibody test. And these antibodies can be detected, depending upon the person, in a few days to a few weeks after you've resolved the virus. What we're looking for here is, does your body mount an immune response that will hopefully deem you immune from future infection? So if people get this test and they say, yes, you have the presence of antibodies, that does not mean that you are 100% immune from reinfection. it does mean that you've developed some type of immune response. But what we're trying to figure out now is what is sort of the appropriate level to determine that you are truly immune. So these tests are going to be available more widespread. There's over 30 companies that currently are FDA approved, with 110 more coming. And again, those serological tests where we look and look for the presence of the virus after to determine if you have immunity, those can be produced results in about 2 to 15 minutes. I want to transition as we get ready for the Q&A to look at treatment options. Many people have heard of the first one, the remdesivir. This is an investigational antiviral drug that has shown promise and statistical significance in recent clinical trials to be helpful. There are many other drugs out there as well that are currently undergoing clinical trials. Another thing that we've heard a lot of discussion about is convalescent plasma, where we take someone who is recovered from the virus and we actually take their plasma and then ensure, of course, that it's safe, and we give that to another patient that is undergoing treatment for COVID-19 infection. And so this is something that is showing promise as well. And the last thing that I want to mention is most people have talked about why are they given antibiotics for COVID when it's actually a virus? And that's a very fair statement because viruses are not killed by antibiotics. Antivirals are the best chance that we have. But what we've found with COVID-19 patients in hospitals is that many of them have secondary bacterial infections. And that's why you see physicians and other prescribers administering antibiotics to treat that as well. And then lastly, what do we do if we have symptoms in isolation? The CDC has very specific guidance out there if you've not had a test versus if you have, and looking at sort of your return to normal. When can I return to work? When can I come out of isolation? And one of the best guidances out there is if you're doing it via a test methodology, meaning that you're going to get tested again, you want to have 2 negative tests 24 hours apart. So that's really important, and you need to have your symptoms resolved. That's going to tell you when you can sort of emerge from isolation. If you have no symptoms, but you tested positive, then they also have guidance that's very similar to that. Again, we want to make sure that you don't have any symptoms, and if you're doing a test, to rule it out that you have those 2 negative tests 24 hours apart. So what is likely the new normal? Well, this is sort of a crystal ball question and that I can't answer fully because I don't think anybody fully appreciates what that new normal is. But we recognize that there will be continued elements of social distancing. We'll continue to see a bigger focus on infection control. We recognize that healthcare providers and public health authorities will look for additional ways. And those additional waves can be countered by quick contact investigations where we actually go out and interview these people and determine where they've been, where it came from, and rapid notification of the public to determine what are some of the things that we might need to change. I'm going to tell you, one of the biggest vulnerable areas that we've seen is nursing homes. This has been all over the news media if you've watched the news at all. And these patients are literally captured in nursing homes without any visitation. Many of the staff are overworked and overburdened. And so I've seen some of the most amazing stories with spouses outside of windows trying to sing to their loved ones. We've seen nursing home staff members that have really stepped up to the plate, offering their own personal devices with FaceTime so that family members can actually visit with their loved ones. And I can't tell you how sad it is to see that. And I'm very, very hopeful that we can reopen nursing homes as quickly as possible as long as it's safe. And then lastly, we're going to see changes in how hospitals prepare themselves. Having seen one hospital in the area that had 6 months of personal protective equipment and it was gone within 1 week when they got hit with an outbreak with this, we need to think differently about how we staff hospitals, making sure that healthcare providers can move from area to area that have sort of crossover skills and then also address critical supply chain shortages. So as we conclude the sort of discussion piece of this and move to the question and answer, there is a lot of information that's up in the air related to this. But I can tell you confidently that just like we got through SARS and MERS and Ebola and the bird flu, we will get through this. It's going to take collaboration and it's going to take communication so that we are always informing the public with what we know, what we don't know, and what they can do to help. We need to put more emphasis on those vulnerable populations like those over 65 with chronic health conditions that are in nursing homes. And lastly, we can employ a really simple and evidence-based approach to stopping transmission by staying home if we're sick, by preventing contact with people that are ill, practicing hand hygiene, using face coverings, disinfecting. surfaces when we can, and then self-isolation if we become ill. And last but certainly not least, we want to make sure we take care of your mental health and stay healthy. The American Red Cross has actually offered a free COVID mental health class that's available on their website, which is redcross.org if you're interested. And with that, I want to conclude about there's some, again, the important reminders of going back to the CDC website. If you've got questions, you can also reach out to your local or state health department as well. I provided some electronic resources if you're interested in learning more. Many of these are geared for both healthcare professionals as well as the public, but we wanted to make sure that you had those available to you. So with that, we're going to open it up for question and answer. Judy, do you want to make any comments about how they can do the Q&A?
I would love to. Thank you. Hudson, that was great. Thank you so much. Your expertise is just beyond anybody else I know. So I appreciate it. And I appreciate there's no spin on it. So it's very clear for me to understand. So anybody that does have a question, we want to field it for you. On the side, for me, it's on the right side. There's a place that says question. Just type it in there and we will try to get to each and every one of those.
So it looks like the first question is why are the majority of new cases in New York from people that are classified as work from home type and not as healthcare providers? So that's a really good question. If you are staying at home, and Judy, I'm hearing a lot of background, so I'm not sure if that's...
Let's see. I'll turn off my mic.
No problem. So this is probably a fairly charged question. What we're finding is that a lot of people that are quote unquote working from home are still going out, or they have some type of interaction with someone who is coming. Even the healthcare providers that actually were infected, most of those were from community transmission, not from interactions in the healthcare facility. So that's most likely why that's taking place. We will continue, unfortunately, to see healthcare providers become infected. The majority of times when this takes place, this is actually from improper removal of their personal protective equipment. And so if you are a healthcare professional and not used to wearing all this garb, CDC has an amazing resource that's video-based where you can actually see how to put on the PPE and how to remove it carefully. This is really, really important.
That's it. I'm going to pop in with a question from our guest. I think you're going over with the questions we got ahead of time. So we have a VIP question for you. How safe do you think it is for swimming pools at private clubs to open?
So as long as you can put in place basic infection control measures, I think it's safe. So for example, if it's a chlorinated pool, chlorine is going to very easily inactivate this in the water. So there's really no risk of that in the water. Saltwater pools are also safe from that perspective. Where we're going to find the risk is in those sort of socializing activities. So if you're able to space yourself out, if you're not sharing utensils, so I wouldn't have a party and have the same spoon, for example, that's going in the potato salad. But other than that, I think it's very reasonable to do that, especially outdoor pools. Believe it or not, UV radiation from the sun is extremely effective at killing most viruses in general. So if you've got items that are out in the sun, like your cell phone and things like that, it's going to readily inactivate this virus. And then bring some hand hygiene. I think that's a great way to sort of do that. But we want to be very careful and pragmatic and having a balanced approach. We don't want people staying at home and going crazy, but we also want people to not go crazy outside by spreading the virus as well. And I think we can do that very safely.
So let's go for one more. I'm still unclear about when someone is capable of shedding the virus. I've heard that people can be positive without symptoms, but then others have said you can only shed the virus when you have a fever or other symptoms. Can you clarify?
Yeah, that's a great question. So originally when everything was being learned about this new novel virus, the thought was that people would only shed or be able to spread when they were symptomatic, meaning that they actively had symptoms. And we've since proven that that's not true. So as long as you're within that window, that incubation period where you do have the virus and it's active, you can be completely symptom-free and still shed the virus. And so that is certainly a great question.
I have hypertension. Should I continue to take my ACE inhibitor medication with COVID rampant in my community?
It's a great question. Think about hypertension and the side effects of not taking your blood pressure medicine. The answer is the American College of Cardiologists does recommend that you continue to take your medications as prescribed. The benefits of taking these medications for chronic health conditions far outweigh any risk. And right now, there's no evidence that hypertensive medications are going to interfere with this. So you would want to continue to take those. And if you have questions, you can always reach out to your primary care physician, your healthcare provider, or your cardiologist as well.
Perfect. Those of you on your computers or on your phones, we're going to pop in a couple of poll questions just to keep you interactive. So this one is, we just want to get a little bit of the demographics. Are you over 65? Do you have a chronic medical condition, or do neither apply? Neither. So we have a healthy crowd. This is perfect, perfect. And one more for you, and then we'll go right back to it. Because we did launch this out to the public as well as healthcare professionals, we just want to know what do you do? Are you retired? Do you work outside of healthcare or inside of healthcare? And we'll share. Well, we have a lot of healthcare workers. So just like the people out in public, all of us are starving for accurate information that's easy to understand. So thank you for participating. Okay, so we're going to go back to it. I'm concerned about people not wearing masks. Please address the importance of doing that. So,
yeah, I've seen that myself. Certainly myself, I only have control over my own actions. At least outside of a healthcare facility, you're not going to go in a hospital right now and find people not wearing masks. I could say that, and there's a reason for that. We're trying to reduce what we call source control in ourselves as well as source control in other people. So if we're wearing a mask and the other person's wearing a mask, the sort of possibility of transmission is very, very low. If you are going into like a grocery store or somewhere like that, stay away from people that are not wearing masks. Right now, that is the current CDC recommendation. And again, it doesn't have to be a mask. It can be a general face covering. Anything is going to stop sort of those droplets that are being shed. But for right now, that is a best case scenario, and we would want to make sure we practice hand hygiene, wear face covering. But that being said, we also want to be realistic. You don't need to wear a mask if you're in the car by yourself driving down the road, which I see every single day. You don't need to wear a pair of gloves to touch your steering wheel when you're driving down the road by yourself in the car. And gloves, quite frankly, actually spread a lot of organisms, not just viruses, but also bacteria. So it's not a general practice to wear gloves when you're going out.
thanks, Hudson. What tips can you offer caregiving for older adults?
So if you're caring for an older adult in your home, recognize that first your person that you're caring for is at high risk. So you want to make sure that what you're doing outside of the home and inside the home is not going to increase risk. And so wearing a facial covering when you're interacting with that person, making sure that they have their own toiletries and things like that, if they can have their own bathroom, those are all good things. And then look for signs and symptoms. For our older population, these are folks that are really likely to have to be hospitalized. And so we want to make sure that we take extra precautions. If you have soiled linens, for example, if you're coming home as a healthcare provider and you're coming home to care for someone, make sure you go ahead and wash those clothes immediately, wash them by themselves, and then wash them in a hot or antibacterial cycle. These are all basic things that we can do for any infectious disease, not just COVID.
If I have an antibody test and it shows that I'm positive, does that mean I have immunity?
That's another good question. So hopefully that will be what we will prove. But right now we don't know that. So an antibody test is essentially useful for one thing today, which is how many people have been exposed to the virus and have recovered. That is helpful information. But the next stage of that would be to say what level of antibody determines if someone is immune and for how long. And we see this with things like hepatitis and measles, mumps, rubella, where we can actually do titers to determine if someone is reasonably immune to that potential pathogen. And we're not yet there yet with COVID, but I'm confident that we'll understand that probably within the next 12 months.
Eye protection out in public.
So there's not a recommendation right now for the general public to wear eye protection. In the healthcare setting, we do because there is going to be that increased risk for contact with a contaminated patient. But for the general public, that's not a recommendation. Now, if that is something that someone wants to do, absolutely encourage you to do that. Recognizing that general eyeglasses, however, the ones that you wear for your prescriptions, are not considered eye protection. In the healthcare setting, we always wear some type of goggle, face shield. And there's been, interestingly enough, a study that came out about a week ago that said if we use a face shield, so something that comes all the way down over our face, that we can see up to a 97% reduction in viral particles actually reaching our mucosal membranes. So that's kind of exciting. And so, that's something to think about. It's not a general recommendation for the public, but it certainly is not going to hurt if you've got one.
If you have a face shield, do you need a mask as well, or just the face shield?
You do. So that face shield is really going to protect your eyes, most notably, but it also gives you extra protection over your mouth and your nose as well. Those are really the three entry points, if you will, that you're going to get this virus. I'm not at all worried about walking through my local grocery store if I'm not contacting people. This thing is not surviving in the air. It's not, sitting around. It's not like tuberculosis. But if I'm going to be in close contact with someone, I want to make sure I'm covering those mucosal barriers.
We want to know psychologically how you're doing with this. What's your current level of concern regarding this virus? Okay.
And I think that's fair, Judy, for the listeners today. I mean, there's a lot of information out there, a lot of misinformation, unfortunately, which was really the premise of today's program, is to provide some factual information as well as where to find information in case you have specific questions. If you're working in a long-term care facility, you're at increased risk. If you're caring for a loved one at home, you want to make sure you protect them. If you're a school teacher, some of our essential workers are completely critical to the lifeblood of our economy. We want to make sure that everyone's protected as well.
I'm worried when I see a healthcare worker out in public in scrubs or in public transportation and wondering about their footwear as well.
Well, the first thing is that in today's climate, we want to hopefully not see healthcare workers wearing hospital scrubs out in the public in general. That's problem number one. I know that facilities that are doing best practices and are caring for COVID patients are actually requiring their staff to change out of their scrubs, and they're laundering them at the hospital. So that's the best practice. If you're seeing someone in your local grocery store or public transportation that's wearing scrubs, I wouldn't necessarily say worry about them. Hopefully they wash their scrubs at home. But that's really no different than anything else. And as it relates to the footwear, most healthcare professionals that are especially dealing with this are, changing their footwear at work. They're leaving that footwear there. Or, if you're working, we've got several people that are joined us from a pre-hospital service that, work in the EMS setting, and they're not taking anything in their home. Everything is coming off in their garage or somewhere like that, or at their station. So the majority of healthcare workers are leaving the germs behind. If you're worried about your own footwear, it is really easily killed. Take some bleach spray or any type of disinfectant spray, and you can easily inactivate this virus on any shoes. And certainly when you take your shoes off, make sure you wash your hands or use an alcohol-based hand sanitizer after that.
Very good. What type of alcohol hand sanitizer would you recommend?
So any of the alcohol ones that are between 60 and 90% would be fine. So, it really depends on what you can get access to be honest with you. Many of the sort of common brands are out of stock. You can also make your own as well if you can find the supplies. CDC.gov does have that information, as well as WHO.int, which is the WHO World Health Organization's website. Both of them have information, and it's really aloe vera, glycerin, and some alcohol, and you can actually make your own alcohol-based hand sanitizer, which is kind of great.
Should mail be cleaned before coming into my home? And let's talk about mail and groceries at the same time. How do I clean it? And is it necessary to leave the groceries in the garage for 24 hours?
No, I've heard this quite frankly a lot. Let's tackle the mail question first. Your mail is probably contaminated every day with something because it's going through the mail system. And you'll notice that your mail workers are very often wearing gloves in general. They always wear gloves. And so when you're handling your mail, go ahead and open your mail. I wouldn't recommend opening it on your countertop in your kitchen for sure, and that would be a general recommendation I would have. I personally actually open a lot of my mail. It's in my garage, and so when I get it, I immediately open it. I shred what I don't need. I throw everything else away, and then I wash my hands after that. And that's true for any packages that I receive. I got an Amazon delivery last night. I had no qualms going out and getting it with my bare hands. Came in and immediately washed my hands just like I would always do. So a lot of what we're talking about does not need to change based on coronavirus, but it's just general basic infection control practices.
One of the benefits, if we can call it a benefit from this virus, is hand hygiene stats have gone way up. So yeah. I think that's the blessing behind the curse, I think. Okay, here's a good one. Does Clorox or slash bleach kill COVID?
Absolutely. Yep. So all the disinfectants are regulated by the Environmental Protection Agency, which is the EPA. And EPA has published a list on their website, which is epa.gov. Right on their homepage, you'll see a link for coronavirus. It'll take you to a list of all of the commercially available approved products in the United States that are effective against coronavirus. That being said, I'm often asked, I don't see coronavirus on the product label. It's not on the back of the canister. That means it doesn't kill it, right? And the answer is no. These very evolving pathogens like Ebola virus, coronavirus, stuff like that, you're not going to find them actually on the product packaging most often. So if it's on that EPA list, then it's deemed effective. That being said, I'll tell you there's many manufacturers that are actually testing this specific strain of coronavirus right now, so you could very well see that added. But most disinfectants in the United States are going to be extremely readily effective against this, including just a 1 to 10 dilution of bleach, which you can make your own with liquid bleach.
Thank you. Why were we initially told we did not need to wear a mask because they weren't helpful, but now we're told that we need to?
You know, that's a great question. Initially, you're correct. There was not that recommendation for the general public. As more community transmission took place and more was learned about sort of the true spread of this virus, that recommendation changed pretty rapidly. And again, remember the word novel coronavirus. It's new. So there was not a lot known about its specific transmission. And we're seeing this in healthcare too. So it's not just the community recommendations, but it's very frequently changing in the healthcare space as well to say, hey, do this or do that. This is not effective. This is. So we'll continue to learn more about that. But a facial covering is the best practice to prevent transmission from you to someone else and hopefully from someone else to you. So that is why the CDC is now recommending that.
2 questions. Are all cases listed on the Johns Hopkins site confirmed swab test, or are some just diagnosed case? Second question is on count of deaths. How many of these deaths are positive COVID swab cases, and how many are assumed?
So that's a really good and loaded question. So the Johns Hopkins are confirmed by some type of viral technology to determine the presence of the virus. That is, again, dependent upon how it's reported by the state health department. So that data is coming from the states in different countries. So if the state, for example, were to report a case that was not confirmed, that data could be in there. But the thought and sort of the requirement that we've tried to push out there is that it should be confirmed by some type of test. That's not always the case. And if you watched Dr. Fauci's testimony yesterday, he fully anticipates that there's more cases out there that have not been detected because we did not necessarily have that initial widespread testing, or we had people that had deaths that we didn't know were related to this because maybe we found them in their homes or something like that. So there's going to continue to be more information out there. As it goes to overall deaths, there's a lot of sort of discrepancy out there about this and how facilities are reporting deaths. But for the most part, if someone dies and does have active COVID infection, most likely they've been included in this data set and captured as a death associated with COVID. Even though COVID may theoretically not have been the cause of death, they're assuming that it most likely is. And again, we'll probably see changes in how this information is reported that'll be driven at the federal level because COVID infection is a federally reportable infectious disease now. So that means that all cases are reported to the CDC. We're also looking at that through the hospital data as well that's reported up also to sort of match it up.
So Hudson, there's been some media talk about padding of numbers of COVID. So these deaths that are reported, is there a requirement to have a COVID test, or is it because of the constellation of symptoms?
Most likely it's not required to have a COVID test. Many of these patients will have had a COVID test. Especially those that were hospitalized, we can feel pretty confident that those people have been tested. What we will continue to see is probably a lot more testing in the outpatient setting and even at-home testing. So I know one of the questions that I see come in here is, will there ever be a test that you can do at home? And the answer is it's already there. So LabCorp already has an at-home test that's called Pixel. And we will see more of this where you can actually go online, fill out your information, and actually get a test sent to your house. As a matter of fact, I have one here that I qualified for as a healthcare provider. And you'll also see more widespread community testing that can be done at what we refer to as point of care. So, some of the initial drive-through clinics, if you will, you had to wait several days. So you were swabbed, and then you had to wait 2 to 3 days to get your results, and someone called you. Now the new best practice is you pull up, you get swabbed, you pull up to the next tent, and you wait 15 minutes, and you get your results. So before you ever leave, you have an idea of what your true test, was it positive or not. And so we will see more and more of that and less of the sort of waiting game that we saw in the past. But I have to tell you, the amount of tests we have out there and how rapidly they got through the FDA is unheard of. So I know a lot of people are upset about that delay, but I've never seen such rapid approvals in my life. And we will continue to see more and more of those, but recognizing that not everyone had access to a test, but that will be changing.
Well, let's go a little deeper on that. What's the efficacy of these tests? Because one of our questions is there's discrepancy in the accuracy.
Yeah. So, of course, like any test that we have in medicine, they're not always 100% effective. So, for example, the PCR test, which is our most reliable swab test, is a molecular test, and it's extremely accurate. That's what we use for confirmatory testing to say, yes, you are definitely positive with a very high reasonable suspicion. The new antigen test that came out recently in the last week, that one is only shows about 85% of people that are positive actually positive. So you've sort of got that 15% wiggle room, and that's just for that one particular test. Each test has its own sort of faults and pros and cons, if you will. Your healthcare provider, if they're using any of those tests, should be educated on that information. So it is always the best practice if you're doing one of these point of care tests to request that you get a confirmatory swab. And that can be done in your doctor's office as well. Again, that's not available everywhere right now because it just was FDA approved in the last week, but you will see more and more of that.
When do you think it will be safe to return to small family social gatherings?
I wouldn't have any qualms about that in most places now, as long as everybody is following sort of the social distancing. People are asymptomatic. If you haven't had any risk factors, and a risk factor could include being around someone who potentially had COVID, being around someone who did have COVID, traveling outside of your local community, going to a hotspot. But I think you can pretty safely do that in most instances, especially if it's family members that you're always around anyway. So, if 3/4 of you are under the same roof, it's really low risk. But I would certainly, engage you to sort of do hand hygiene and things like that. Make sure you're staying home if you're not feeling well. But we also want to get back to some semblance of normal.
So this is about normalcy. Sending my child to summer camp. How do I make that decision?
Well, I think you first want to start with, where is the summer camp? Is that an area where there's widespread community transmission? Are the staff members taking the appropriate screening steps? Are they screening the counselors, for example? Are they screening the kids? Are they screening you? Those are all things that should be in place prior to feeling very comfortable as a parent sending your child to camp. But a lot of times this is not going to affect kids near at the rate that it's affecting adults, but there will be adult counselors there. And then look at health services that are available. If something happened at that summer camp, is there a nurse? Is there someone there that can intervene quickly and take care of my child if needed? But you can really do a lot of things safely, especially outdoor activities, as long as there's good precautions. So if you're going to play any type of organized sport, for example, make sure all the equipment is disinfected between use. If you can't do that, don't play that sport. But there's lots of activities that we can do. If you've got kids in the lake and they're spread out and having fun, I really don't have a lot of issues with that versus if they're all on the same piece of equipment, and it's pretty impossible for me to keep that clean.
So we're talking about getting back to normal, and before it was don't have a gathering more than 50, then less than 10, then we social distance entirely. So do we have a number now, like less than 10 is keep social distancing of 6 feet apart? What's your thoughts?
6 feet, yeah, so 6 feet is still the general recommendation. Remember that this is a droplet spread disease. And so droplets are large particles that very easily fall to the floor. So there have absolutely been studies, just to be candid, there's been studies that have shown that these droplets can go further than that. But that is not the norm, and that's not always happening. And so if you are keeping a social distancing of 6 feet, if you want to do 10 feet, 12 feet, it doesn't really matter. At least 6 feet is what's recommended by CDC. And again, a face covering, if you're going to be around other people, is best practice for right now. I do not believe that we will be a society that is wearing face coverings for the rest of our lives. I don't believe that. We've been through SARS, we've been through MERS, we've been through other diseases like this. And keep in mind, we also have things like the common cold, we have the flu each year, and we don't wear masks for all of that unless we have somebody that's symptomatic. And so we want to get sort of that halfway medium point of what do we feel comfortable with, where's the data pointing us, how do we stay safe?
Is there any update on the use of ibuprofen?
There are some guidelines about what type of pain medications that you can use. The same is true for steroids as well. CDC has published that information on their website, again, cdc.gov, and you can actually view that based on what other health conditions you have. My general recommendation would be before you take anything that you contact your personal health care provider so that they can look at your complete medical record and determine what's the most effective medication for you. If you become febrile and you've got a fever, you want to first check that temperature, report that to your healthcare provider along with any other symptoms you might have or exposure, because there are some medications that you may want to avoid depending upon if you test positive, and that's a decision your local healthcare provider would provide in collaboration with what other medications you might be on.
My son was around someone who tested positive with the virus, and he was around me and my family. Should I be concerned?
So, that's a difficult question to answer unless you know a couple things. So, for example, if the child and your son both wore a mask or some type of face covering, then the incidence of transmission is very, very low. The risk is very low. The same is true for two healthcare providers. If I interact with the patient and I have a mask on and they have a mask, and I'm wearing my PPE and I wash my hands, the risk is very low. If your son was around someone and neither one of them are wearing any type of protection, and that encounter was close and prolonged, so it was under 6 feet, and he was around him for a period of time, then that would be concern there, and you might want to look at self-isolation according to the CDC guidelines. But that's something that you could have to have a little bit more information on. So if they've got questions about that, I'd be happy to address those, and my email address as well as my social media is available.
This is a question you and I actually discussed before the webinar today. If masks are working to control the virus, why wouldn't it be safe to open everything and go back to normal? If they don't work for controlling the virus, then we could go back. So why are the recommendations as they are?
So a mask is a general term. There's sort of general facial coverings, which is what CDC's recommended, meaning that these are not FDA tested. They don't have any type of efficacy testing. We don't know how long they work, exactly what they do. If you go one level above that, the regular procedural masks that a lot of healthcare workers, like if you go to the dentist, are wearing, those surgical masks, we have data that suggests that those are effective for a period of time. That period of time is not an entire day. It's not a week or anything like that. And then we have respirator masks, which are about 95 to 99% effective, depending upon the filtration level. So the thought is that since most of these droplets are large, if we're both wearing something to cover our face and our mucosal membranes, then we're going to stop most of that transmission. If we keep the surfaces clean and disinfected, that's going to reduce it even further. And if we wash our hands, that's going to be even better. So right now, that's why that recommendation exists. It's really about stopping transmission from one person to another. But generally speaking, if you don't need to go out, don't go out, especially if you're in an area where there's localized community spread. I think that's really the best advice I can offer is if your community is rampant with this, don't go out if you don't need to. If your community is doing well, then that's another story. But what we don't want to do is take our eye off the prize and sort of let down our guard and then have a spike in transmission. And the other thing, too, is that people around you may not be wearing masks. You may be, but they may not be. And we can't control and mandate that every single person wear a mask unless it's an employer-driven thing.
How do we distinguish between an increase in cases due to increased testing versus increases in infection spread?
That's a great question. So if we look at total number of cases in the U.S., we are far above any other country. And the reason that we are is, and I don't, I can only tell you this from experience, I don't think it's necessarily that the U.S. specifically has more infections than other places per capita. We have done more testing than anywhere else has. So we will continue to see numbers increase. And again, if I look at my hospitalizations decreasing, my deaths decreasing, I know that I'm at a good place. And so that's really the numbers that I'm looking at. I don't pay a ton of attention to the overall cases, other than we know that that sort of percent positivity, meaning the percentage of people we test, right now, as of last night, was about 15% of those samples were positive. If you look at the New York City data, for example, 25% of the population was estimated to test positive, but there was nowhere close to 25% of the population that was in a hospital in New York City. So we really want to look at that. And community transmission is carefully tracked by the states. So your state health department has data that's available. You can also look at your own county level on the Johns Hopkins map as well as the CDC map. And I think if all of those indications show decreases, then you can feel pretty safe in your local community.
How effective is Lysol?
Lysol, like many disinfectants, is going to be effective. I would, the thing with any type of spray, however, is that the spray needs to reach the virus. So if you're using a spray and then you immediately wipe it away without letting the disinfectant work for its contact time, so if the canister or the spray says leave on surface for 2 minutes, you need to leave it on the surface for 2 minutes prior to wiping it away. That's really the key here. But most all disinfectants that you're finding in the U.S. are going to be very effective against them.
Is herd immunity better than vaccination?
Herd immunity is a positive consequence of vaccination. So when we think about vaccines, and I could get off on a whole tangent about this, vaccines in the U.S. especially are extremely effective. They're extremely safe for the most part. We have lots of safety data related to this. For those that are skeptics, the CDC's vaccine division, for example, accepts zero outside money, zero. So they are completely sort of isolated from any type of industry bias. Vaccine reportable events are also reportable by law to the Food and Drug Administration. So we have great data that says that vaccines are effective. With this one in particular, what we're worried about is, let's say a vaccine becomes available December 31st. If we look at our influenza vaccination rates every year, they're not near what they need to be. So we could get, let's just say 60% of the country could be vaccinated. That 40% that refuses is hopefully going to benefit from the herd immunity of being around those that actually have been vaccinated. But we don't want to rely just on herd immunity. We want to rely on sort of a combination of strategies of knowing how many infected persons are there, looking at immunity testing, looking at treatment options, and finally looking at a vaccine strategy as well.
Thank you. Is it safe to fly?
I think most airlines have gone above and beyond what's required by CDC to encourage safe flying. So if you had a legitimate need to fly, I would not have major qualms about flying, as long as your airline had the necessary precautions in place, meaning that the flight attendants were wearing a mask, you were required to wear a mask, except if you're eating or something like that. Many airlines have actually discontinued food and beverage service. The airlines are all screening their employees prior to boarding, and in many cases internationally, passengers before they board are being screened, and some are actually receiving rapid COVID tests. So what that will look like here in the U.S., I think, is yet to be determined. But I really want to encourage us to support our vendors, our airlines, our local businesses, places like that when we can safely do so. But I do think, especially the U.S. industry, is taking that very seriously. They're putting in places, disinfection of every aircraft after every flight. I can speak for Delta because I've seen their protocols as well. And these U.S. airlines are taking it seriously, and they're following the CDC guidelines. So I think it's reasonably safe to fly.
What about cruises?
I knew somebody was going to ask that. The cruise industry also has guidance for that. one of the big differences is that the airliners actually have HEPA filtration on board for the air system. And so, and they've always had that for many years. And so they're really set up well to stop and limit that sort of disease transmission other than the social distancing. So if you've got 3 people in a row and you're having to touch each other and, you know, all that stuff, that's not good. With cruise ships, it's a little bit different because they are captive audiences in small quarters in many cases with large buffets and things like that. So I wouldn't necessarily recommend a cruise today, but I absolutely think that the cruise industry will emerge stronger and they'll have new precautions in place. We've had major emphasis on hand hygiene on cruises, and we'll continue to see that. But I think you'll probably see less things like buffets and places like that that have that sort of natural inclination to have disease transmission, and we'll see some changes there. So I would probably wait a little bit longer on something like that.
When should we think about visiting elderly relatives who live alone?
You know, these are vulnerable populations, and I think if you can reasonably visit them and wear your mask and they've got a mask on, I think that's okay. As long as you're not symptomatic, you've not been around someone who is symptomatic, or you've not been exposed. We want to make sure that we take care of others. That is something that I can't stress enough. In nursing homes right now, it's bad enough that people can't visit. The psychological implications and impact to our elderly in nursing homes are far more profound than we will ever understand today. Sort of the PTSD, that post-traumatic stress disorder impacts of this on healthcare providers, we have not fully appreciated. And so if you've got an elderly person that you can check on, that you can deliver food to, even if you greet them from the front door and they're still in the house or the front lawn, that makes such a huge impact psychologically for these people. So I really encourage you to do that if you can do that safely.
Do silver impregnated cleaning cloths kill the virus?
I'm not aware of a silver impregnated cleaning cloth. Most often when metals are added to cleaning products, it is going to be designed to not allow for regrowth of bacteria or viruses, and some of these products are not effective against viruses as they would be against bacteria. So I wouldn't make a general recommendation for that. I'd have to look at specifically the efficacy testing for that type of product. So I would not make that general recommendation with that general question, unfortunately.
A couple more gloving questions.
Sure.
Your thoughts on wearing gloves while shopping or while gassing up your car?
Shopping, no. Gassing up your car, yes. You know, when you think about shopping, there's really no need to do that. You know, I would absolutely take some hand hygiene with you, take some, you know, alcohol-based hand rub or something like that. Many grocery stores are actually offering it. I went to a grocery store the other day and I was so impressed. They had a huge sign and they had a gentleman that was standing there, and before you could come in to touch the carts, you actually had to sanitize your hands. And then he would wipe down the cart for you with an alcohol-based wipe that they had. And then when you left, they offered me hand hygiene again. And I told him, I said, I'm really impressed with what you're doing. And he said, oh, sir, this is only what we're doing for you. You should see what we're doing for our employees. And I was pleasantly surprised to see that. So, you know, glove use in general is a dangerous thing for the general population, even in hospitals. We don't want to see people wearing gloves and touching elevator buttons and things like that. The same is true for office buildings and stuff like that. But if you're going to touch something that's probably a more high-risk item, like a gas pump, then you can certainly wear gloves. I think that's fine. But grocery stores and other essential services are doing really good things to try to do this. Another example might be if you go to the ATM where there's no one regularly disinfecting those surfaces. That would be okay. I know for myself, I do put on a glove when I pump my gas, and I've always tried to do that. And then I immediately wash my hands when I remove that. So even if you wear a glove, I want to stress this, you need to still wash your hands. Glove usage does not negate the need for washing your hands.
How long does the virus live on shoes? We're walking around everywhere, and then we walk into our homes.
So the virus can survive on different surfaces for a matter of hours to days, depending upon what surface, and there's a lot of data that's emerging around this. But the good news is that you can kill it super easy. So if you've got shoes, spray them down with a disinfectant or wipe them with a disinfectant, and then immediately wash your hands. The virus is going to be dead. Some people put their shoes outside. That's okay, but unless your shoes are upside down, you're not going to get the soles. So it's really probably a simpler practice to just use a disinfectant. If you have a bleach solution, you can do that as well. If you're a healthcare worker, I would really encourage you to leave those shoes at your place of employment, in your locker or some other area, or put them in a garbage bag. That's what I do when I come home from work, and I put all my clothes in a garbage bag or a biohazard bag, and then I wash those separately, and my shoes never, ever enter anywhere where my residence is.
I'm on a task force at church to evaluate a safe reopening time for services. Can you speak to that?
Sure. So if you are looking to safely reopen your house of worship, I think that's great. People need their spirituality. So we're not just looking at the physical and economical and emotional needs, but we also want to look at the spiritual needs. There are guidelines that do exist now from CDC that are on the CDC website for specific reopening criteria. For example, you might want to look at screening all of your volunteers. You could also look at screening your parishioners that are coming in. A temperature screen alone is not adequate, so you do want to ask the questions because a lot of these folks, again, will present without symptoms. And so doing a temperature check alone, which is what unfortunately I see a lot of businesses do, is not adequate. You want to make sure you also follow your local recommendations from your state. So if you are not allowed to have social gatherings, things like that, that might prohibit that. But I think in general terms, we can reopen many of these places safely as long as we adhere to the CDC recommendations, like hand hygiene when you come in, hand hygiene when you leave. I happen to be Catholic, for example. I wouldn't necessarily want the priest to hand out communion over and over again. I think that type of practice you'll see changes in, where there's going to be that potential hand-to-hand transmission or hand-to-surface transmission. So we will see some adaptations with our normal, religious processes, but I think we can do that very safely.
What precautions are you not worrying about when you go out to the grocery store, and what are you worrying about?
I worry about close contact with people. I worry about people that are actively symptomatic. I was in actually a gas station the other day while working, and I had my mask on because I was working. Many people in the gas station did not, and there was a man that came in the front door, and he was coughing up a storm. And I, of course, didn't know why. It could be allergies. It could be a lot of different things. But I made like a road runner and went out the back door. I went to a different store. So even though I had my PPE on, and I was actually wearing a respirator because, again, I was working, I'm not going to engage with any person that is actively symptomatic, especially coughing, because we recognize that coughing is really probably the worst case symptom because that person is expelling those droplets out into the air. And because he was not wearing any type of facial covering, that increases the risk. So those are some general guidances that I would offer.
Is it safe to keep a mask in my vehicle or take it off while driving? I'm worried about contamination during the removal process.
That's a great question. So, certainly don't want you wearing it as you're driving because, when you wear these masks, and I think, Judy, you can speak to this, having worn these as well, they are god-awful uncomfortable. I don't care what type of mask you're wearing, they're not comfortable. If you're wearing a true surgical mask or a respirator, they get more uncomfortable by the minute. It changes the sort of, gases in your body, so we want to make sure that we're getting adequate oxygen. So a simple technique that I actually use is I have a Tupperware that's a square Tupperware with a lid, and I actually put my mask down in that Tupperware so that the outside that faces away from me goes to the bottom, and then I pull the straps over the top of the Tupperware and close the lid. And the reason that I do that is when I go to put my mask back on, I'm only touching the outside of the Tupperware, which I keep clean. And so I'm never touching the outside of my mask. We do recognize that there is data that's pretty good that says if you are, taking your mask on and off, that front of that mask can be heavily contaminated with lots of stuff, not just coronavirus, but lots of stuff. And that's a quick, easy way to do that. If you're a healthcare worker, certainly best practice is not to have to reuse this stuff, but that's not the world we're living in right now. And so I think we're going to see a marked change in what healthcare providers do. We have such reliability on disposable products and masks, especially those that are coming from countries like China. And we've got to move away from that so that we have readily accessible supplies of personal protective equipment, not just for healthcare workers, but also for the general public if needed.
Is there a specific type of fabric or material for these masks that you'd recommend?
So you can make it out of a variety of different sources. One of the recommendations CDC has is multiple layers. I've had questions about, should I put a coffee filter in there? What can I use that I might have around my house? And the answer is there's really not a lot of wrong answers with that. If you're doing a facial covering, you're simply trying to keep something from going from yourself to someone else. So, it's not going to necessarily prevent the other person who's not wearing a mask from giving you something. That's really something where we have to have a more aggressive type of mask. But there's really not a specific recommendation that you have to have in any type of fabric per se, but you want to have multiple layers. Certainly most people are going with cotton because it's somewhat breathable, and multiple layers is again the thing. And I did provide that slide that's got the link on the bottom where if you're looking to actually manufacture your own mask or even make them for other people. I had a friend that made masks for an agency that I work with, and he made 60, and it was a phenomenal gift because it was something that we could wear over our respirators as healthcare professionals to help sort of, reduce risk to that repeated use.
When can my kids and their family come home to my home or grandkids stay overnight?
So if you are at no risk, then I would feel comfortable doing that now. If you're a healthcare professional and you have an increased risk profile like myself, I would not necessarily do that as of yet, just because of the risk that you have that's ongoing. And keep in mind the incubation period that this virus sort of stays around is about 14 days. So if you were exposed, 14 days afterwards, you don't have any symptoms or anything like that, then I think it's pretty safe to do that.
Would you recommend the folks that come in to clean an office building or a medical building after hours wear a mask?
Absolutely. I mean, I think we want to be careful about saying some people should wear a mask and some people shouldn't. The CDC recommendation is that if you're going to be in close contact, that you wear a mask in public. And certainly the shedding of that virus can come from your respiratory secretions. And one of the biggest high-risk activities we have to shed is talking. So if we're wearing a mask when we're talking to our colleagues and friends, that's going to reduce the shedding of the virus onto the surface. So it would absolutely be a best practice for any personnel that will be in the public setting like that to wear some type of face covering.
I work in a hair salon. Should I wear a respirator when I'm working with clients? Or do you have recommendations on how I can safely do my job?
So right now, there's no recommendation for a respirator to be worn by members of the public. The recommendation is for some type of facial covering. Respirators are really reserved for high-risk healthcare activities, so even all healthcare providers are not being issued respirators right now. And there's a huge shortage of respirator masks that is gradually being fixed. The federal government has obviously commissioned PPE to be created by lots of different companies like GE and Ford and companies that we would have never thought would be involved in this. But right now, a respirator is not a general recommendation for that. I have seen at least one state board of cosmetology that I've heard about is recommending and requiring a respirator. Certainly, you need to follow your state board recommendations, but that's not a best practice from a safety standpoint. A regular mask or facial cover would be acceptable, as well as one for your client.
Perfect. Is it safe for individuals in high-risk group to go out in public with cloth face masks?
I mean, a high-risk person should try to limit their public exposure in general right now, just because you're at increased risk for having a complication from the virus. Again, many people that have tested positive from this virus never had a symptom. They never knew they had it, and they recovered just fine with no health issues, no side effects, those types of things. So I think we want to be somewhat prudent about this, but that would be my recommendation.
If a vaccine is available, should I get it? And will it be safe since the process for the new one has been so truncated?
That's a reasonable question. Vaccine safety in general in the United States, because all vaccines go through the FDA, is a very proven process. So yes, it is a fair comment to say that many people are going to be worried about that. But if it goes through the FDA process, the safety boxes still have to be met. It just means that there's no long-term safety data. So like the flu shot, for example, we have lots of years of safety data. With this one, though, it'll probably be made using an advanced technology that is a lot safer and more widely producible. So I will be the first person in line to get it, if that tells you anything. I have the utmost confidence in the vaccine safety processes in place by the FDA. And again, just because the vaccine is being rushed through the process does not mean that they can, miss any of the safety bars. But I would be the first to get it.
I am a healthcare provider. I'm wearing an N95 mask. If I have a nasal secretions occur, should I lift it to use a tissue, or does this contaminate the mask?
So any mask in general, if it becomes wet, the membrane is no longer effective. And I've had this happen to myself, where I sneezed inside of a mask and I did replace that mask. So if you do get that mask wet, you would want to change it so that the membrane was still intact. You don't want to ever lift the mask or anything like that. So it's an unfortunate reality that you have to sneeze in the mask and then live with that for a little while, and then take that off. If you're a member of the public, and you're using a facial covering or some type of cloth mask, then you can wash that, of course, and reuse that. Again, basic soap and water, basic heat technologies are going to kill this virus super easily.
This is a great question. What procedures should we put in place for our employees so we all have a safe environment when they return to the workforce?
So if you're a business owner, thank you for thinking about that and trying to protect your customers and your workforce. There are general checklists. I have one. If you're interested, you're welcome to email me, that I've created for businesses. CDC has general recommendations as well. So you're looking for things like temperature screens, ask them actively, do you have any of these symptoms? Have you been around anyone who was suspected or confirmed COVID? Have you been outside of your local community? Have you traveled? If they answer no to all those and they don't have a fever, then you can feel pretty safe. And that needs to be done at the beginning of every single shift. If you're looking at your customers that might be coming in, so I'm thinking about if you're going to get a haircut, which fortunately I was able to get a haircut the other day finally. And I was screened outside of my car prior to entering the salon. And so that was a nice practice to see. So there were multiple different checkpoints that they could take to ensure that customers coming in don't do that. But those would be the best practices for the workplace. And certainly, if they're going to be close contact, let them wear a mask or a facial covering. If you're able to spread that out, or you have different workstations, then that might not be necessary all the time. But if you can't accomplish that, then that would be a good thing to do.
What about going to the dentist for just a cleaning, preventative care?
I had a dental emergency, if you will, where my crown came off recently, and I had to call the dentist. And of course, I am high risk because I've been exposed to these. And I could hear the silence from the other end of the phone when he asked me the question, "Have you been exposed?" And I said, "Well, yes, many times." And I actually provided them a respirator to wear. What they were doing was not an aerosol generating procedure. It was just basically, taking the cap, putting it back on with some glue. Very, very low risk. So what you're going to find is that there's going to be some pretty big changes, I think, in the dental practices, not just with a mask, but also the eye protection. So a lot of dental procedures do generate aerosols, which is where we know the biggest risk is for this. There was unfortunately a recent survey that came out looking at different types of healthcare providers and who was at the biggest risk. Guess who was at the top? Dental hygienists. 99-something% risk with their procedures. And so if you're going to the dentist, make sure you inform them of any symptoms that you have. If it's a true dental emergency that's going to require aerosols, you're going to find that most dental health practitioners will be wearing some type of respirator, or they'll refer you somewhere else that has that PPE available to you. But for general stuff, it's pretty safe to do that as long as they're following the necessary precautions. And the American Dental Association has put out recently updated guidance as does CDC.
Gyms are starting to open up. Is it too soon to work out in a large gym?
Well, if you're one of those people that needs to work out, I think you want to figure out a way to make that work as long as the gym is taking that seriously. So I know one gym that I've spoken to lately is actually blocking off every third piece of equipment so that there's some type of mandatory social distancing in there, so that people are limited. I've seen frequent disinfection of those environments. I've even seen a gym that's installed HEPA filtration in the gym, which is a great thing to do as well. And then they require hand hygiene and a questionnaire, including temperature. screening as well. So, if your gym is doing those things, I think it's safe to go back. Certainly, if they're not, that's not an environment I'd want to be in right now.
A couple of questions on, is this webinar being recorded? The answer is yes, and it will be available on the AVA Academy next week. So anybody that has missed it or their friends have missed it and they'd like to see it, you can go to AVA, AVA info, INFO, and you'll just go to the AVA Academy from there and you'll be able to find that. So I will close that one up. Does CDC have a sample health screening questionnaire for businesses to utilize?
I'm not aware of an actual questionnaire that's in a questionnaire format. I do have one that I've developed for some of my clients. So if you're interested in that, you're welcome to email me and I'll send that to you. It is, again, subject to change. So, for example, I've made 6 changes to it since I launched it two months ago, based on other things like sudden loss of taste or smell as a new symptom, those types of things. But I'll be happy to share that with you. But all of the things that you should consider as a business are on the CDC website, and there's interim guidance for reopening your business that I would encourage you to check out if you're a business owner.
Getting a temperature reading doesn't tell you if you have coronavirus, does it?
No. So even if you're febrile, even if you have a temperature of, let's just say 102, doesn't mean you have coronavirus. You could have all kinds of host of other infectious ailments. And so we don't assume that you have coronavirus per se, but we treat you as if you do until we prove otherwise, given what's going on. So if you were to come into a healthcare facility and your symptom is a fever, we will screen you for other things. We will do a coronavirus test as well to rule that out. But just because you have a fever does not mean that you do have coronavirus. And just because you don't have a fever doesn't mean that you don't have coronavirus. So it's really about looking at that total picture of that. So if you're, again, a business owner or someone concerned, do not rely just on checking a temperature. Make sure you ask the screening questions every single time someone comes to work for that shift and every time a customer walks through your doors.
Can you be around someone that has coronavirus and not get it? But if you were around 100 people, could you get it easier?
So the biggest risk with exposure is the proximity and the duration of time. So if I'm close to someone for an extended period of time that is positive, especially someone who's symptomatic, then your risk goes up exponentially. But just because you're in a room with someone, if you're one of 100 people in a room and that person's in the other corner of the building, then no, you're not going to have a huge risk. It needs to be prolonged exposure and a close sort of contact situation. So you'll see lots of people, including, right now the CDC director self-quarantining as an example, which is quite ironic, as well as, other members of the coronavirus task force. And that was because there was a reasonable risk of prolonged contact with a very short distance between those individuals. But that's not going to always happen. And again, your local health departments have epidemiologists on call. You can also call the CDC if you ever have a question. CDC has staff available 24 hours a day that will answer questions both from healthcare providers as well as members of the public in case you've got questions. But your local health department would be my first stop.
One more question about wiping down groceries, because I just want to, should we wipe down our groceries when they come in the house?
I don't think there's really a general need for that. Again, we don't do that in general, and we've had other coronaviruses like MERS and SARS, and we've never changed those practices. So yes, this is new, but we did not have a vaccine or a specific treatment for MERS or SARS. We do not, have a widespread vaccine for Ebola. So it's very similar. So I don't think we need to swing the pendulum from one side of the equation to the other and overreact. But I also wouldn't put all my groceries on my countertop and just leave them there and not disinfect that surface. I would certainly make sure I wash my hands afterwards. If I'm bringing something in from like a Costco or a Sam's and it's in a cardboard box, I would discard that box in the garage and just bring the items in. So I think there's some really quick, easy ways to do that. But again, if you think about hand hygiene, if we just wash our hands after we touch stuff, this stuff's not going to have a chance of surviving transmission. So it's really easy to kill.
I tend to have cuts on my hands. How can I safely wash my hands and not have the virus enter my cuts?
So the virus is not going to be transmitted via a cut. So it has to come in contact with the respiratory type membrane. So your nose, your ears, your eyes, stuff like that, that's a wet mucosal membrane. This is not like hepatitis B or anything like that where there's sort of that bloodborne transmission. Now, that being said, we have seen complications in the bloodstream of coronavirus patients. You may have heard about people that have had strokes or they have clotting disorders or things like that. That's not how it's entering. It's entering, again, through those respiratory secretions and then affecting other membranes. But if you're wearing a cut, as I would always tell you, you need to make sure you cover that, especially if you're in a work setting. If you're wearing gloves, make sure you practice hand hygiene. And again, if you're a healthcare worker, that cut should be covered anyway.
What about ear pods? How many people remember to clean their ear pods? Question mark. It's like I'm texting by voice.
I'm not really sure exactly what they mean by ear pod.
I think probably like our little, these guys.
Yeah, so those are really easy to kill, but we're not seeing transmission via the ears. The ears can get ear infections quite easily with other things, but that's not a big concern that we have here. If you're sharing those items, however, then I would certainly make sure those are disinfected between. I do know that, not to pick on Apple, but Apple has put out guidance on what to disinfect their products with for the first time. So kudos to them for doing that. But any piece of shared devices or equipment or utensils that you're using like that, make sure that you can clean those between. And anything that we shouldn't be sharing, like hairbrushes and toothbrushes and stuff like that, we want to absolutely make sure that we don't share those with other persons.
Hudson, can you scroll back on your PowerPoint and repost the page with links to the information?
Sure. So actually, I will do one better.
Do one better.
I'm going to send it in the chat box.
Beautiful. Thank you. And I will put it in handouts. Thank you.
Perfect. Yeah.
Okay. How often should we put them in the washing machine, our cloth masks?
Every day, I think would be good. So after every day of use, so if you're using a cloth mask, have a couple so that you don't have to do laundry every single day. But again, the act of washing and drying alone on normal cycles will take care of coronavirus with no issues at all. If you're a healthcare worker and you are bringing any clothes home from your workplace, it would be a best practice to wash those separately. But that would only be because of the sheer amount of potential contamination they have. But your washers and dryers, as well as your dishwashers. So if you're using anything that you're worried about, like a glass or a fork or something like that, the dishwasher with just the detergent alone is going to take care of this. And then, of course, with the heat cycle is going to kill this almost instantaneously.
So we should put our mask in the dishwasher?
No.
Just messing with you a little bit. Okay. If we had the option and we wanted to get tested, what is the best type of COVID testing available?
So it depends on what your purpose of testing is. So if your purpose of testing is to know if you actively have the virus, then I would contact your local health department or your healthcare provider, and they could actually schedule you for a test. Any person that wants a test, for the most part, should be able to get one in their jurisdiction. Whether or not it's right down the street is a different story. If you're in a major area, you'll probably have no issues with that. If you were looking, however, to determine whether or not you were exposed, let's say that you felt sick back in January, which I've had several people that have said that, and they couldn't figure out what they had, and they want to determine if they were exposed, then the antigen testing, that antibody testing, would be the appropriate thing to do. But it really depends on what you're trying to accomplish. And then, of course, when we get a vaccine, we'll have a different sort of story with that, because we'll look for antibodies produced by that as part of that safety study and efficacy study with the vaccine. So there's a lot of exciting information. I've really never been so excited about the possibilities to protect the public as I have been with this particular pandemic, with frankly how many different people from opposing views and opposing organizations have come together to try to protect the American people.
How do you get the antibody testing if you want one? And does it depend on where you live?
So that testing is not near as widespread as the general testing for presence of virus. So as I mentioned before, there's already one point of care test that's antigen based where you can just get a prick of the finger. We will see more and more of those. We are over 30 different tests for just the PCR. And so it'll really depend on what your healthcare provider has access to. LabCorp and Quest Diagnostics are the two largest national laboratory chains. They will both be administering this as well. So you can always get referred there. And many of those places actually allow you to make your own appointment online. If you want the at-home test, LabCorp already offers that on their website as well. And I would expect that that will become the same truth with the antibody testing in the future.
Has there been an increase in pediatric cases in the New York/New England area?
There have been, from what we're monitoring, right? So just to be transparent, there's not been a lot of widespread testing of pediatric patients in general because they've not presented as sick. And so this particular outbreak of illness, especially in the New York City area, CDC, the State Department of Public Health, and the WHO are all looking at very carefully. We have not seen that widespread across the world. So just want to make sure we're being, transparent about that. But, pediatric patients also do present differently. And certainly we want to make sure that we're screening all populations, not just adults and not just older adults, but looking at kids, especially those that are symptomatic. And so we're not yet sure how closely tied this pediatric disease illness with all of this inflammatory process is tied to COVID yet. I think we'll learn more in the next few months about that, but certainly we want to keep a close eye on our kids.
And we talked in the last webinar that we did about the constellation of symptoms being from none at all to GI symptoms, respiratory symptoms. So, gosh, I mean, it's really hard to kind of pinpoint like, okay, I think I have it. If you just have diarrhea versus you have full-blown respiratory distress. So it's
right. And as we move into the fall and winter months where we have generalized respiratory illness that's widespread, like flu, that's really one of the big concerns is to make sure we have the instant capability to do testing on people that are symptomatic. So for example, if we get to the winter months and you present with flu-like illness, it's probably going to be pretty reasonable that you're also going to get tested for COVID, just as part of that general clinical treatment process. Right now, I think that's where we'll be moving. And as we have these rapid diagnostics, it'll be instantaneous. It won't be something you have to go somewhere special for. You can do it at your doctor's office, just like we do for a flu or a strep test, where they can come back in your exam room and say, hey, you have this or no, you don't. That's what we're moving towards. But again, keep in mind the large mountains that have been moved in a short duration of time. This was originally discovered in December. It started hitting the U.S. in sort of that January to February timeframe. We're just in May, and yet we have all of these different resources that are either currently available or in development, as well as a vaccine that we are extremely excited about. So we're moving in the right direction despite how difficult it has been, and we're in uncharted territories.
Ethan has a young infant at home. He's less than 2 months old. How much precaution should he take with having family over to hold the baby? What precautions should I take when taking him out into public?
Well, the recommendation is not to mask infants or small kids under 2. So that means that baby is not going to have any true respiratory protection. Keep in mind that infants also don't have that fully developed and exposed immune system. So that's another area of concern. So, I mean, it would really be best practice not to take him out in public unless you had to. And if you're going to have people over, ask them the question, have you been exposed? I would never be offended if someone did a temperature check on me when I went to visit them. It's something that I take very seriously. I would not want to expose my own family to this. I have 2 amazing parents, both of which that I think are actually listening to this program today. I do not even want to think about exposing them to this. And so it's so unfortunate that I haven't been able to spend quality time with them, but it's something that we have to take seriously. And the same is true if you're exposing someone to your young child that probably doesn't have that strengthened immune system. You'd want to take the right precautions. But I'm not saying by any means don't do it, but do it under the right precautions.
Do you think the coronavirus will show up again this fall, similar to the flu?
I think that's a pretty strong prediction that most people have had based on the epidemiology model. So it's very reasonable to think that that will take place. And, right now we don't have widespread circulating flu virus. In the fall and the winter, we will, just like we always do. And so what'll be interesting is to look at sort of how do we segregate this out to say what is COVID-related illness versus what is influenza-related illness. And again, the best way for us to do that is not going to be based on the symptoms because they're so similar, but rather to do it based on the testing that we have available to do that. And again, a lot of this fear will go away when we have a widespread available vaccine and we have FDA-approved treatments. And right now, we've got our first clinical study that showed a proven treatment in decreasing length of stay of a hospitalization, which is huge. It's absolutely huge. And we want to continue to see more of that so that we can give the public greater confidence that if unfortunately you do contract COVID infection, that we have relevant treatments and tools necessary to treat you so that you can have the best possible outcome.
I need to get my hair done. When I'm allowed to go to a hairdresser, should I wear a mask and either hold it in my hand or loop it behind my ears?
Absolutely. I think that you're going to find most states, as well as places outside the U.S., are going to recommend that. I know here in the state of Georgia, that is a recommendation. The hairdresser or stylist has to wear a mask, and it's strongly encouraged that the client does. Where I go to get my haircut, it's actually required that the customer wear a mask as well. So, when they're doing certain things, like if you're getting a shave or something like that, you're going to see a lot of the stylists are actually wearing some type of face shield also. So there are many different steps that hairdressers and stylists are taking to do that. But it would absolutely be best practice for both you and that stylist to wear a mask.
As a healthcare provider working in a hospital, should we be answering yes to COVID-19 exposure on all questionnaire screenings?
If you've been exposed, yes. I answer yes, I've been exposed, and I answer no, that I'm symptomatic. So, you're always going to have that risk. And as a healthcare professional, there's probably a pretty large possibility you've been exposed and didn't even know it. And again, this is true for most infectious illnesses. How often have we, especially those that work in the emergency room, where you get a phone call and you're like, hey, you were exposed 3 days ago to a patient with active tuberculosis and you had no idea. And it doesn't mean that you ever develop TB, but it is something that we want to be cautious of. Now, I do want to make one general comment for our healthcare providers on the phone. We have to sort of emerge into a new world of standard precautions where we look at all of our patients as potentially infectious. So, for example, if I'm going to be caring for a patient and doing some type of respiratory treatment or an intubation or something like that, I also need to cover my eyes, not just wear a mask. So that's something that we're going to see a change, I think, in healthcare providers' circumstances, including places like the dentist, where they have a high risk of exposure of aerosols in the air.
Are there any concerns that a healthcare provider is not getting an adequate sample, which leads to a false negative test?
Certainly. So the test itself is dependent upon the collection technique and the quality of the specimen. It also can be degraded if the actual swab is not properly handled. So there are lots of things that can go into that. So one of the outcomes that comes from that question is, what do I do if my test is negative, but I'm hugely symptomatic? Then I'm going to treat you as if you have COVID, regardless of what my test tells me. The same is true if somebody comes in and they present for signs of strep or influenza. All of these tests are not 100% foolproof. And so we're going to always look at the patient before us and determine whether or not we want to go ahead and treat them. If you come in and you have all the symptoms of a urinary tract infection, but our laboratory work says that you may not have an infection, we're still going to treat you. And we're going to treat you empirically to determine what might be going on, because sometimes our tests are not properly collected. Sometimes there's laboratory error. And so we're always going to look at the person in front of us.
What type of clothes to wear in public that would protect me the best? Have there been any studies on that?
No. So the general population has not been studied as far as the types of fabrics. Viruses and bacteria, by the way, do like to readily adhere to fabrics. This is one of the recommendations that's come out in a hospital setting, especially for people that work in like the operating room or other procedural areas, to not wear scrubs in from home and not to wear those scrubs home after they have their shift. For the general public, though, there's really not a lot that you need to do. other than to wash your clothes. And so the virus, again, is very easily inactivated with that. Now, that being said, if you were to go visit a nursing home, for example, when they reopen, or some other type of high-risk area, then it might make a lot of sense to wash your clothes when you get back. If you're going into a healthcare facility, they're going to offer you some type of personal protective equipment if you're interacting with patients. But we also want to be judicious and say there's really not a lot that we have to change at home than what we should be doing is sort of basic hygiene principles all along.
Why does the U.S. have the most COVID cases?
That's sort of an open-ended question, but if I had to guess, it's because we're doing the most testing. So if we look at other countries, we're reporting everything. We're very transparent about it. Other countries have not actually taken that same route. If you look at our population, the latest data that I published on my slide was about 15% of samples were positive out of those close to 10 million specimens. As we continue to do more testing, we'll see more positive cases. What, again, I'm looking for as far as sort of a barometer of success is, do I have more people in the hospital? Do I have more people dying from this? And do I have adequate healthcare resources? If I have a decrease in hospitalization, a decrease in death, and I have adequate healthcare resources, I'm moving in the right direction from this curve. And again, some of that will be driven by local data. A lot of that, however, will be driven by what the CDC is looking at nationally as well as internationally. Because what we've not talked about, and I'm actually surprised nobody asked this question, is, should I travel internationally? Do I feel safe getting on an international plane? And we will see international travel reopened. And I think you're going to see some very different practices related to how we screen people coming into the U.S., as well as how you're screened getting on airlines and things like that.
That question was coming. You beat me to it. Shot there. So changing track a little bit, we have a lot of cases, but we're not doing a lot of contact tracing. Why is that?
So contact tracing is really it has the most utility at the beginning of an outbreak. And we will continue to do that, especially in areas that have hotspots like New York City and some of the other jurisdictions where there's ongoing community transmission. But you're not going to see contact tracers all the time. Like I said, we know we have a pandemic. We know it's widespread. We know where most of the infections are. And we have more widespread testing today than we did in the last few weeks. So there is some utility in it. But honestly, if you look at where do we want to spend our resources, that's probably on the lower end of that totem pole. Now, if in the fall, for example, if we see more cases and we see a huge curve again, then you're going to reinstitute more widespread contact tracers where we go out into the community, trace these people's steps, and try to understand that. Or if there's a large social gathering like funerals, we've seen lots of outbreaks associated with, and that's where the health department would go out and do that. But for sort of these onesie-twosies, that's not a good use of public health resources.
Okay, so Gordon's ready to go have some fun. What about going to sporting events, concerts, or the casino?
So, again, in accordance with current guidelines, social distancing is still in effect. Hand hygiene is needed, and then wearing some type of facial covering. So, you will probably see some type of sporting events. I know several of the major leagues have decided to resume services with limited seating, and I think that's fine. As we get a better handle on this and we see sort of the widespread community transmission across the U.S. and the globe decrease, we'll probably see somewhat of a return to normal. I was even listening to the news before this, and they were talking about, changing airline seats, so one person's flying backwards and things like that. We didn't do any of this for other viruses that we've had that had far greater of an impact and larger death rates. So I think, again, we want to be careful about moving everything in society from one side to the other without first understanding what is the true incidence of disease, how many people are actually in the hospital from it, and that type of stuff. And also, what can we do for immunity? Because do we really want to change everything about society for a virus that hopefully we'll have a vaccine for, and I feel even more confident that we'll have good treatment options for. So even if we don't have a vaccine, which, by the way, we don't have for MERS or SARS, and we're not freaking out about that, let's say we have good treatment options, we have a good place to start, and we can treat these patients aggressively with very, very little consequence for long-term health.
How about going to the beach?
The beach is outdoors, and it's normally around sun. So I think that's probably a good place to go. especially if you're looking for some outdoor time. And again, social distancing would be helpful. If you're with your family and these are people you live with, then you can sit with them. You're already exposed to them on a daily basis. But if you're going to have friends and loved ones come and join, just spread your chairs out a little bit. I think that's very reasonable. And again, on surfaces, that UV light is very effective, but it's not going to do much to take care of the virus inside the human body. But I think these outdoor activities we can, very easily resume as long as people are following those guidelines.
If I have a mask, or if I'm making a mask and it has a pocket for a filter, what would you recommend for that filter?
There are, commercial filters that you can buy out there for masks, but honestly, if you're looking for a filtered mask, I would, buy a regular procedural mask or something of that nature. Again, those masks, however, don't work for long periods of time, and they also don't work if there's any type of moisture in the membrane. So if you're really looking for something quick and easy, you can get a facial covering. Some of those fabric masks that you can wash on a daily basis, that's actually probably the best use of money. And then stay away from people that are sick. If somebody's sick or you're sick, stay home. I don't think we need to go, overboard with this and invest in certain types of filters and stuff like that. Because again, the purpose of you wearing a mask in the public is to prevent spread of transmission from you to another person. It's not going to prevent you from getting something from another person. So that's why we say we want everybody to wear some type of facial covering so that we can protect both parties.
I've heard of some folks cutting up a vacuum bag and using that. And we don't know what that membrane is. So I don't want to be breathing in those membranes either. So we have to be thoughtful about what we're using.
Yeah, and one of the advantages of some of the healthcare masks, especially the respirators that we wear, is that they are tested. They're not only tested for efficacy of transmission of viruses and other organisms, but we also want to understand what does it do to our own sort of gas exchange in our body? Are we getting too much carbon dioxide, stuff like that? So I'd be very cautious about sort of homemaking, doing it yourself, if you will, mask. That you don't know what type of filter, to your point, that you're putting in there, Judy. I think that's a very fair question. That's why a general face covering is very adequate for the public.
A patient with a recent transplant within the last year, any specific warnings that you would offer?
So because you're on some type of immunosuppressant, I would imagine, then yes, you would be at high risk and you'd want to avoid any unnecessary public contact right now. Certainly if you have to go to your doctor's office, if you're receiving infusion, stuff like that, many of these places are calling the night before. They're asking you to wear a mask. Some of the best places are screening you in your car before you come in. But you would definitely want to make sure that you take the precautions by staying home if you can. If you're working, certainly your employer would hopefully make a reasonable accommodation to allow you to work from home. Or if you do need to go in for some purpose, you would want to wear a mask for sure. For those types of patients, then that would be where I would want to see somebody actually have a mask if they could. But again, that's not widely available. And keep in mind that CDC has sort of 3 tiers of recommendations for use of personal protective equipment. The first tier is in general day and time where we have no issues with availability. And we have no pandemics. The second situation, which is where we were originally, was, we might have a problem here and we're having decreased availability of PPE. And where we are right now is what I call crisis mode, where we don't have enough availability of PPE necessarily for every healthcare provider, much less the general public. And so you'll find very often, and this is the first time I've seen CDC do this, where they're essentially having to make recommendations that they don't fully agree with, but based on availability of supplies. And nobody from CDC controls PPE. They only control the recommendations. So they're not at all saying don't wear PPE. They're simply saying that if you have to pick and choose who gets PPE that's available, we want to give the respirators to the healthcare providers that are at highest risk. We want to have everybody else in healthcare wear a surgical mask, and the general public can wear some type of facial covering and hopefully self-isolate and stay away from people if they're sick.
And we appreciate the 200 plus of you that are still hanging in with us. We have about 6 more questions that have been posed, so we're going to go through those. What about bags from the store? Should you bring your own or use theirs?
I'm a big proponent of bringing your own just in a general sense because it's going to help the environment. And again, if you're using your own bag, the advantage is you can bring it home and wash it. So that's an advantage that you have that you can certainly follow.
Is there a recommended process for reporting of those positive at-home tests to compile an accurate number of confirmed cases?
Good question. So if you're tested at home and positive, those results will automatically be transmitted to your local health department as required by federal and state law. So if you're doing a test with like LabCorp or something like that, they will report that test based on your address that you provide when you're actually tested.
We know that there have been autopsies of some of the victims of COVID-19. What did we learn from those?
So we found that in many cases there was a lot of inflammation in those patients. Many of them had a clotting disorder that essentially caused the blood to become very thick and unable to move throughout the body. We've seen chronic respiratory damage in the lungs and other areas. So there's a lot that we've learned from those and we'll continue to learn. There's not a ton of autopsies that have been done on these patients for obvious reasons. But we have found that many of these patients sort of share the same symptoms that present inside the body. And so it presents, should I say, very similar to like sepsis or some of the other conditions where we see this massive inflammatory response. With this particular virus, it affects a lot of different things. So if you have a vulnerability, if you're a dialysis patient, for example, it's going to affect your kidneys. If you have a COPD or some type of chronic obstructive pulmonary disease, it affects your lungs. If you're a heart patient, it affects your heart. And so it really capitalizes on any internal vulnerabilities that you have from other health conditions. And that's the biggest thing that we've learned.
Is there any benefit from wearing a nose plug and breathing through your mouth only?
No, I think unless you're swimming, that's probably not a realistic thing for you to do. And again, the transmission is not going to be limited to just one port of sort of entry. So if you're closing your nose and you're breathing through your mouth, it could very easily go through your mouth. And again, the majority of people that actually contract this will not even present with symptoms most likely. So you may never realize that you've had this virus until you actually have antibody testing if you do, or you self-resolve the illness on your own with zero medical intervention. And that's the good thing about this, is that the overall mortality and morbidity of this is pretty low.
Should people that are high risk wear a respirator if available when they're in public to protect themselves?
So if you're at high risk, you're going to take extra precautions. And if you have access to a respirator, I certainly say go for it. That's not a current recommendation from CDC, but if you have access to one, I think that's fine. The best thing that you could do is to stay away from public settings if you're at high risk. Many stay-at-home orders are actually specifically targeting those types of people to say, please stay at home. Let us come to you if we need to. But if you do have to go out, I think it's pretty reasonable to wear that respirator if you want to. But again, the only difference between the respirator and the surgical mask is that the respirator is going to be much more efficacious, but it's not 100%. And given that this is not an airborne virus traditionally like tuberculosis, you don't need to wear a respirator all the time. So, respirators are very uncomfortable. They can cause facial breakdown of your skin. If you've watched the news, you certainly know what I'm talking about with the tremendous healthcare professionals that are wearing these things. So I would sort of do that very cautiously.
And additionally, they have to be fitted. So a respirator is not a respirator is not a respirator. So
correct, absolutely.
Because a lot of nurses are having to reuse their masks. Do the UV sanitizers that are sold for phones work on masks? Are they worth it to get a few more uses out of a mask? How many times could they be reused if they remain dry and are sanitized with UV after each use?
So if you're referring to a mask that's used in a healthcare setting, which I'm assuming is the basis for this question, the FDA and CDC have put out specific guidance by mask manufacturer of the most appropriate way to reprocess these devices. So number one is that these devices were never designed to be reprocessed. They are disposable, single-use devices. So we're in, again, that crisis mode. Number two is that the manufacturers in some cases, and some of the big ones like 3M as an example, have done some type of validation to help consumers and healthcare providers know how to reprocess these. The general stuff that you're going to buy on Amazon and things like that is not going to be near as effective as the traditional reprocessing efforts like your vaporized hydrogen peroxide. There's some sterilization capabilities that can be used. The challenge is that many of those technologies, especially over repeated use, will break down the mask, the straps will pop, things like that. So there's not a hard and fast rule that says that it's only good for 2 to 3 uses. It really depends on the physical integrity of that mask and any manufacturer validated data. So even if the manufacturer says, hey, your mask is good for 10 uses, 10 reprocessings, and after the 5th reprocessing, you go to put your mask on and it's cracked, obviously it's no longer intact. And the same is true for our consumer visitors on the call today. We want to make sure that if you're wearing any type of mask, that it is fully intact, even if you bought it commercially.
So I am a medical provider, and I am working as an independent contractor with high-risk patients. How do I obtain proper PPE?
So if you're going in as a contractor to other healthcare facilities, most likely the facility, if you have a contract with them, should be providing that. So for example, if you're entering a nursing home at their request, then they should be providing you PPE. If you're going to a hospital or some type of clinic and you're entering on their behalf, you should be provided that PPE. And that's really because the facility, you should be following that facility's infection control guidelines. And so they should be providing that to you if you don't have your own. That's a general practice. If they don't have PPE, then I frankly wouldn't go in because, again, there's no pandemic for a healthcare provider that classifies as an emergency to go care for the patient. If you look back to Ebola, where the consequences were much higher, the risk was much higher, the amount of body fluids was much higher, you never once saw a healthcare provider run into a room without PPE. They took the time to put the PPE on, and they did it correctly, and they made sure that they protected themselves because the healthcare provider's multiplying force is their expertise. And so, the same is true for members of the public. If you're a single parent, for example, and you become ill because you don't protect yourself, what happens to the 2 children at home that are relying upon you for assistance? And so we want to make sure we take all the necessary steps to keep ourselves safe.
We thank you so much for being here, Hudson. I can't thank you enough for your expertise and willingness to do this for everyone. Be safe out there, and hopefully we'll see you next time. Bye, everybody.